StoryHinge, Episode 37, Matt Brown, Marriage and Family Therapist.
And I think that's a really precarious place to be in, to have this sense of, I can control the way my life goes, because I think most people you talk to would say that that's not true. There's a lot of things we can influence and a lot of things we can pursue and develop, but to a large extent, we're kind of in this precarious place in life where a lot of things out of our control will happen to us.
Welcome to StoryHinge, where we unfold more meaning and value in everyone's personal story. At StoryHinge, we explore foundational ideas and beliefs through diverse personal stories in order to discover more meaningful paths, greater happiness, and accelerated growth in one's life. We believe everyone has a beautiful story to grow. Now here's your host, Jason Vadari.
Hey, welcome to StoryHinge, everyone, and thanks for tuning in. Today we're going to be spending time with Dr. Matt Brown. Dr. Brown is a licensed marriage and family therapist, and is going to share about some of his experiences and insights he's gained through his profession. Additionally, Matt and his wife Lisa are the proud parents of 3 amazing daughters, all of whom have Diastrophic dysplasia, which is a form of dwarfism. We're going to hear their story and insights along the way. Enjoy this one. All right, so excited today. I'd like to introduce our guest today, Dr. Matt Brown. Matt, welcome to StoryHinge.
Yeah, thanks for having me.
Here at StoryHinge, as you know, we like to go back a little bit in history and hear a little bit about your background, maybe some things that led up to your profession, and why don't we start there?
Okay. So I always kind of had an interest in what makes people tick, I guess, and that led me into psychology, which I think is where a lot of people land that have an interest in human behavior and things like that. But I think as I kind of went through some of the classes and kind of started reading some of the research, I realized I was a lot more interested in what was going on between people rather than kind of inside people's heads, if that makes sense. So relationships have always been really fascinating to me. So I happened upon an article in my undergrad about marriage and family therapy, and at that time I didn't really know what it was. So I started reading about that and just realized that was really kind of how I thought about the world and people. And, marriage and family therapy is pretty heavily influenced by systems theory, which kind of looks at interactions between people and how families, family dynamics work and things like that. So that really piqued my interest, and I haven't been bored since. So that's kind of where it all started, I guess.
Anything before that would influence, kind of that path? I mean, earlier in your life, some of your growing up? Yeah,
for sure. So I guess anybody that's familiar with marriage and family therapy knows that when you go through a training program, you learn and explore every facet of your upbringing possible. So yeah, I think about kind of some of my own family dynamics growing up and, my relationship. A lot of it, I think my relationship with my dad and kind of how that shaped me and how, some of the struggles that we had early on connecting and learning about his upbringing and kind of how his parents shaped him. It's helped me to understand a lot some of the ways or some of the reasons, I guess, that he does what he does. And so I think some of the early struggles I had as an adolescent, just, kind of the typical rebellion and just butting heads with my parents and seeing how that affected our family and just working through a lot of that stuff, I think gave me a lot of personal drive, I guess, for figuring stuff like this out and figuring myself out first. I think that's really, I think, what is at the core of all this is, as much as in my professional life, I'm helping other people with their relationships and their individual life problems and things. It's really been a journey for me to kind of get to know myself and get to know my family and strive to have healthier relationships myself too. So I continue to learn about myself and my own struggles and my own resources and capacities. And so I think that's, personal growth and relationship growth has just always been really interesting to me. And I think it kind of was born out of some of that dysfunction early on that I experienced.
Okay. And have you found that pretty helpful, I guess, through, but I guess first, how long have you been in this profession now?
But it's 10 years now.
Okay. So some time. And have you found it fruitful in this growth area and this understanding area?
Yeah, for sure. I think that's one of the most exciting things for me is to now that I'm a professor now and train therapists that are going into marriage and family therapy, and just seeing them kind of go through that same journey of figuring out why is it that I constantly find myself in these types of relationships, or I'm constantly struggling with anxiety or depression or things like that, and just seeing them go through that same journey that I initially took, and helping them to discover those things that they need to address and work out, possibly with parents that they have now they've moved out of the house and they don't have a great relationship with now, but kind of helping them go back down that road of self-discovery and figure out what their story means and what they want it to look like moving forward. I think that's probably one of my biggest passions, is just helping people take those fragmented pieces that kind of get left along the way when you go through trauma and dysfunction, and reintegrate those into their lives and pursue their passions and pursue individual and relationship health.
Do you have a specific example you could share with us on where you shared help someone along that journey?
Yeah, so I think this is maybe kind of a bigger, I think you could break it down into individual people, but I had an entire group it was an all-female group of students, which tends to be more the norm in mental health. And a lot of them that semester, they have an assignment where they write about, basically, if my family had gone to family therapy when I was an adolescent or a child, why would we have gone? What was going on in our family? How might it have helped? So they really kind of put themselves back in that place mentally and emotionally to try and re-experience some of that and write about it. And every single one of those women wrote about some of the damage that had occurred based on their relationships with their fathers. And it was kind of a unique experience, because here I am, the only male in the room, right? Kind of talking to them about some of these things. And we had this moment where we were all kind of processing that paper together. We frequently sit in circles in class and kind of try and, have a dialogue that way. And so we were sitting there talking about this, and I remember just a lot of the negative messages these women had received from males throughout their life. And so I felt the moment was right for them for me anyway, as the only male in the room, to convey to them what I saw in them in a positive way. And it was a really emotional moment for me to communicate to them that I see so much strength and growth and possibility in each of them. And, the belief that I had in them, that they would go out and have a positive influence on the world and on the profession. And it was a great and really powerful experience, I think, for all of us, for me to feel like I had been able to be a positive male voice in their lives, and for them, I think, to hear from a male that they had value and that they had a lot to offer, and that their stories only added to that.
That's cool. That'd be cool. Now, I'm going to kind of move back here, and speaking of that male, and I want to move back to hearing about your daughters. Did you have daughters during this time already, or is this before that time?
Yeah, so I had, so my oldest was born when I was completing my undergrad, and then my second was born a couple months before I started my master's degree, and then our third was born during my PhD. So at this point, this story I just shared, I had all three of them, and we were here in Houston. So
why don't you share with the audience here the disability that your daughters do have, and I guess maybe go back to the story and when this all came about, when you first found out this, and we'll kind of start walking through that and how it's impacted your life, and probably you and your wife, and what help that could be for other people out there.
Yeah. So our oldest daughter was born up in Washington State, and we really didn't have any indication that there was anything abnormal during the pregnancy. And then when she was born, same thing. We didn't really suspect anything, and we had a pediatrician that saw us right before we checked out, and he commented on the length of her limbs and how they were shorter than average. And we kind of just thought, okay, well, maybe that's just, the way she is, and didn't really think much of it. But we had some follow-ups with our pediatrician up there and went to an orthopedic specialist, but nobody really said anything. Everybody was kind of just baffled by it and just said she's, all her limbs are fully functional, so let's just kind of proceed as normal. So we did that those first about 18 months, I guess, or 20 months before our second was born. But so our second, during her first ultrasound, they commented on her limb length as well, and also let us know that she had club feet, which, for those who don't know, basically just means that your feet are basically just turned inward on their sides. So so we didn't know what that was either, but they referred us to another specialist to do monthly ultrasounds to kind of track what was going on. And that was kind of a strange experience because that specialist wasn't super forthcoming either. Really, the only information we got at first was we're just trying to rule out that this is a lethal condition, which isn't what you want to hear when you're expecting a baby. So we didn't really, every visit we just kept hearing from her that things looked okay. They were mainly tracking rib cage development and trying to assess whether or not that would constrict her lung capacity, which I guess is what she was referring to with the lethality. But we still didn't really have a diagnosis. We just knew that her limbs were shortened and she had club feet, and we're kind of, I guess, coming around to indirectly the idea of dwarfism, that no one was really saying anything. And so she was born, and so I think a kind of a pivotal moment for me as a dad in that at that time was when she was born. We knew what to expect in terms of limb length and club feet and things like that. But I remember me going with her for her first bath, and sorry, I still get emotional about this part, but I remember, sitting there in the room and there's just windows everywhere, so everybody can anybody who's in the hospital can kind of peek in. And I just remember several people kind of walking by, smiling, looking at other kids, and then coming to her and kind of having a concerned look on their face and staring and staying a little bit longer. And I just remember having this really strong feeling to just go out there and chew these people out and tell them to get away, and just felt really protective of her. And I think that I've noticed that reaction come out a few times since then when I've had that same interaction with people. And I feel like that was really a very unique bonding moment. I think dads oftentimes during childbirth traditionally have been kind of pushed out of the room, right? But I think more and more maybe we're being led into that space, and that was kind of my personal sacred space with her in that moment, to be right there in a protective role and welcome her into the world, exactly as she was. And the same thing with our third daughter. We knew at that point, same thing from the ultrasound, we knew what to expect. And that was a little more unique too, because my wife had to have a C-section on that one because our third was a breech and wouldn't turn. So I was actually the first one that got to hold her and kind of, walk her back to the room and things while my wife was recovering. So another kind of unique bonding moment, I think, for me. So I think from the beginning with all three of the girls, I've just been able to have those important moments where that bond is forged, and I'm also kind of understanding what to expect in terms of the disability. But I guess if I could go back real quick, when Nicole, our second, was born, we were kind of inundated with resources after that. And that led us to connect with the Little People of America, which is an association for families and individuals with any type of dwarfism. So we went to a national conference in New York when she was a couple years old, and some local meetings where we were living at the time, and really got immersed into that world. And at first I think it was kind of scary to step into this space where you don't know people and you don't know much about the diagnosis. And I think for most of us, our initial exposure to disability causes us some discomfort. But I remember this one of the first events we attended, it was kind of overwhelming. It was our first exposure to this community, and we were sitting at a restaurant, this big table, and I remember at one point just kind of spacing out a little bit and staring up kind of at the ceiling and just tuning into some of the conversation that was going on. And it was interesting to me because if I were blind, I would have no idea that anybody in that room had a disability. All the conversations were about work and relationships and hobbies and, all the things that you would expect to have in any conversation. And that was a really unique moment for me to realize. I think sometimes you kind of put these limitations on yourself when you think of disability or you think of challenges, but sometimes I think it's our own eyes and our own perception that create those limitations.
One thing as you're sharing that, and you remind me of a couple of things. I do have one of the other guests that's about to come on StoryHinge is blind, and he kind of shared something similar to that, saying, I think one of his main messages in the podcast is that I'm a normal person that essentially that happens to be blind. I'm not blind, and that defines me, but he talked about his college days and said it was a very normal college experience. And I guess one thing I'd ask you on this is like how, because I know you brought that sometimes there's that being uncomfortable. You don't know how to interact with maybe someone with a disability. Would you have any advice for someone on that?
Yeah, no, I think that's a great question. I think most, maybe if not all, people with disabilities or people in general just want to be considered people first. So I think if you kind of go inward and look at what your own reaction is doing to you, whenever we interface with anything that's different, that becomes the filter through which we interact, I think. And stripping that filter away is extremely helpful. I think most people, I think, with disabilities would rather have you come up and, talk to them as a person and talk to them about what you would talk to anybody about. Maybe not make the disability the point or the topic of conversation, I guess. It's not that, I don't think it's that they're uncomfortable talking about it or, they don't have a lot of their identity based around that maybe. But, and this is going, specifically from things my daughter has said to me. And then kind of talking to some of my students. I have several students that are visually impaired and we've talked a lot about disability, but I think something that has stood out from what my daughter has told me is she loves it when she'll make comments like, "Hey, I made a new friend at the park and they didn't ask me anything about my legs. We just played." Or, what I like about my friends is that even though, I'm have fun. So I think if you kind of put yourself in that human connection space is really helpful. Maybe as you think about interacting with people with disabilities, I think a helpful framework is to know that despite any cognitive or physical or behavioral, differences that you observe on the inside, their heart and mind are ticking the exact same way as yours. They've got the same emotions. They've got the same, the same humanness to them. I think when you connect with people on that level, regardless of disability or different backgrounds or culture or anything, I think we fare much better when we treat people that way.
Okay. I want to dive back a little bit to, you shared some of this already, but I want to dive into more like what was this like for you and maybe your wife as well? I don't know if you can speak to that, but you as a family saying, okay, now we, because no one expects this or no one wants this to happen to their children. You want your children to be healthy and happy, and now they have a disability that they're going to have to deal with their whole lives. What's it like as a father to have that?
Sure. Yeah, I think it's interesting too because a lot of parents of typically developing kids will say things like to parents, "I don't know how you do it, and you guys are so strong," and all that stuff. And our response is always kind of like, "Well, you'd be doing the same thing, if you were in the situation." So I think some of it's kind of automatic. I remember, just initially you kind of go into this, you just kind of do what needs to be done mode, and you don't really think much about how you're doing or how your relationship is going, or you just kind of go into, this is what we got to do, so we dive in. But I think before that, when you initially receive a diagnosis that this is going to be different, and for me, especially that first ultrasound, I remember just kind of having this panicked shock feeling and not really knowing what to do with that. And it was kind of strange. I remember the phone calls that we had with people after that. Everybody was wanting to know the gender, so we called and let family know all of that, and then had to kind of relay this information that was still new to us. And I remember it feeling kind of robotic. We were just kind of using the same words the doctor did and not really having a whole lot of emotion about it. It was just kind of this kind of feeling blindsided a little bit. And I think, the worst thing you can do anytime you get some sort of diagnosis is to go on Google and search about it. We just were confronted right away with all of these worst case scenarios and mortality and all these things. And so that was really tough, I think, to kind of know what we were to expect. So I think my wife and I talked through a lot of that stuff before she was born. So I feel like we were prepared for what we knew, I guess, by the time she was born. But as time went on, I remember just kind of that initial, when our second was first born, it was, at least weekly visits to a hospital an hour away, several casting procedures, a few minor surgeries, and dealing with orthotics and braces and things. And we had just moved. I failed to mention that, but when my wife went into labor, we were right in the middle of a move. So our house was just completely torn apart, and our youngest daughter wasn't adjusting well to having a new kid and everything, and our oldest daughter. And I remember it was, I think, my first semester in my master's program, which I started just kind of a month or so after, or a couple months, I guess, after my daughter was born. But I remember my wife and I both experiencing a pretty significant bout of depression, but not really knowing that the other person was going through it. And both of us just feeling kind of this impending kind of helpless feeling, I guess. And I remember talking to her one day, just saying, I haven't really said anything about this because I know we've got a lot going on, but this is how I'm feeling. And I remember that being such a healing experience for both of us to realize, we're both struggling and it's okay. We can talk to each other about this despite the fact that everything's so chaotic right now. And so I think that was a big learning experience for us. So you have moments like that, I think, where it hits you hard and you can get really down about your life is going to be different and things will be tougher for your kid, and you don't want that for them. You want them to be able to, to have the best life possible. And then you contrast that with an experience I had right when I left the hospital to go pick up our oldest daughter from a friend that was watching her when our middle daughter was born. So I remember leaving that hospital and just being hit with this wave of kind of excitement and hope that my wife and I would have this really unique opportunity to bond around this particular challenge we'd be going through as a family. So that's definitely been true as well. I think it's kind of a mixed thing where there are days where you really hurt for your kid and hurt as a parent, and you just wish the world was a little bit kinder. And then there are other times when you feel this exhilarating excitement and thrill when you watch your kid do something, for the first time that they've been struggling way harder than any other kid to learn to do. And so I think it's just a deeper experience, good and challenging. You have kind of more depth to it.
Okay. Now, were there any other, I guess, foundational things that helped you through this in terms of, was your professional training help out with that? Did you have to rely on, I guess, what other sources you might have reached out to help you put all this together and figure out what the next step was?
Yeah, for sure. I think, as stressful as my graduate work was, I think had I been in another field, I don't know that I would have really had the time or capacity to understand what was going on, and for me and for my family. So the way that master's programs in marriage and family therapy, at least I think other programs to do this. You have a cohort, so you start together with a group of people, and you take every class with that group of people for the duration of the program. So you get really close, and I lean pretty heavily on them, talking through some of these things as we were learning about different approaches to therapy and, different things that families go through. I feel like I got a lot of therapy from that group. As we were all kind of training to be therapists, we were just kind of practicing skills on each other. And I think anytime any of us would open up about something, active listening skills and everything would kick in for everybody else, and you'd have this have this awesome experience. So that was really helpful for me at the time. I think my wife, kind of by extension, got to be a part of that as I was going through it as well. We kind of got to explore a lot of the things that were going to be challenging, and really kind of bask in some of the depth of the positive things as well. And I think for me and for my wife too, our faith and our spirituality has been a huge part of it as well. I think just kind of knowing that, I guess, with our belief system, that everything that we experience here will have meaning in the eternities. So I think having that perspective has been really helpful, and kind of knowing that it's a weird, I don't know if I'll describe this accurately, but knowing that my daughters, all three of them, their bodies are perfect. I wouldn't change anything about who they are and how they're developing. I think it's tough to watch them struggle with some of the things that their bodies make difficult for them. But for me as a parent, I wouldn't change them at all. So I have that perspective, but then also, the faith, our faith and our belief that after this life that our bodies will be made perfect. I don't know what that means, right? It might mean that they're exactly the way that they are now, just in their best condition. I don't know, but that holding out for that kind of more for their sake, thinking that at some point they will be able to enjoy a perfect version of their bodies has been really helpful too. So it's kind of weird. I think that, as a parent, I wouldn't change anything because of what it's done for me and my wife and our family. And then for their sake, you want them to have something go easy for once,
Mm-hmm. Yeah, that's an interesting perspective. So this is a few years ago now. You're a little further down the road now. Any other significant parts of that story as they've grown up a little bit more? Yeah,
I think, as they kind of come into their own and realize what they're going through, that's been interesting too. I think a lot of the advice we got early on was, let them kind of discover the differences in their own bodies and kind of ask you about it, and, take it one conversation at a time, basically. And I remember early on, when we'd go to LPA events, and they'd see adults that were, quite a bit shorter in stature than average height adults, and they would comment on that and comment on how cool it was that there were adults that were, small, that they could talk to and things. And then, each one of them at some point asking, is that what I have? Is that what's going to, is that what I'm going to look like later? And talking to them about that and helping them understand their condition a little bit more. I think that was a kind of a pivotal moment for them. And as a little kid, I think there's maybe a little bit of expression of disappointment, but not as much as we as adults express. So those seem to be pretty easily negated. But as time has gone on, and as they've, had interactions with other kids, especially my daughter now that's in middle school, where she's experienced a little bit of bullying about her size and things like that, it gets tougher because you have to kind of, I think your mindset shifts from kind of letting them discover it on their own to now. One thing I pretty frequently do is I come across videos about people, either doing really challenging things despite physical limitations, or people kind of redefining their worth and stripping away some of the cultural and societal types of value we place on physical appearance and other things that really have no long-term value, in my opinion. And showing them videos of women that speak positively about themselves, despite things that our culture would say are weaknesses or limitations or flaws. And so I started just kind of sitting down with them at night and saying, hey, I want to show you this video real quick. And, they wouldn't really say much afterward, and I wouldn't push it. I'd just kind of let them view it. And, but as time has gone on, we've had some really good conversations about kind of what they go through and thoughts about themselves. And I've heard them slowly start to develop this sense of, having worth and having a lot of strength and value, and not paying as much attention to those negative comments, being able to contextualize them a little bit, being able to maybe think about maybe what the person who's, saying those things to me is going through that would cause them to feel the need to push me down, and learning a little bit about, how we all function, how we all have, despite the way we look or present ourselves, we all have insecurities, and we all have things that cause us to feel less than, and oftentimes that leads us to undercut somebody else. And so there's that. There's, I've also found myself at times just really pushing the assertiveness piece, which I think is tough for a lot of women in general. But, when people are saying you can't do something or saying something about you, it's completely acceptable and okay for you as a female to stand up and say, no, that's wrong, and you need to stop. And kind of watching them step into their own in that area of their life has been really helpful for me. I think as a dad, I just worry a lot about that. I worry that because of the way women are taught to socialize, that they might, they might accept some of those things that are completely unacceptable. So I feel like it's important. I think, I think it's really important to have other females send that message, but I also think it's a unique contribution when a male who, in every, category of oppression and privilege types of discussions, I represent, the most privileged category, I guess, being a white male and upper middle class, and having family and all these things where I've been really fortunate in so many ways, and having somebody, I think, in that position say to you, you have value and worth, and you deserve to stand up for those things that are important to you. I guess I just feel a lot of responsibility to pass that message on.
Wonderful. Any advice for someone maybe in a similar situation earlier in the path than you, and maybe dealing with just got news of a child having a disability or something like that? What would you say to that person?
Yeah, and I've probably underemphasized the role of social support and other resources like that, which is actually pretty typical for males. I think males in this situation tend to value partner or spousal support over more traditional social support and groups like that. But I found that to be really helpful. Just as I've interfaced with other parents, we have a lot of online support groups and things. So I think early on, the more you can connect yourself to the parents that of kids that have the same condition or similar conditions, the more balance I think you find early on, the more guidance you receive from the people who are actually experiencing it and living it. I think all the professionals that help us out are phenomenal, but they're specialists, and they're not. It would be unfair to require of them this type of understanding in addition to their orthopedic specialty or their, whatever the condition is. So you definitely need those supports to kind of help with very critical issues. But that parental support, I think, is huge. And the faster you can connect to groups like that. And I guess if there are any medical professionals listening or mental health professionals listening, the more you can promote those resources to parents that are finding out for the first time or things like that, and connecting them early. We were fortunate to get connected pretty early with LPA, and that has been a tremendous support in kind of understanding what path we're on now, and what life will look like, and the joys and challenges that are ahead of us. And I guess maybe more for men specifically, I know we're not really good at tuning into some of these feelings that are particularly vulnerable and really, I think in our socialization, not useful in most settings in our lives. It typically isn't a good idea to go to your boss and cry and tell him or her how you're struggling. Most bosses don't really want to hear that. They kind of want to know that you're there to get the job done. So I think there's a lot of socialization for men that works against us there. But leaning on your spouse or partner or other parents, I found that to be probably one of the most helpful things in the social support is finding other dads that are as involved as I want to be and proactive as I want to be, and just kind of bonding with them about their journey and supporting each other. So that's maybe just a little bit more just for males in particular.
That's interesting because you have that's maybe if you want to explore that a little bit more, this masculinity side and how that works in society right now.
Yeah, I think it's tough because I think, well, in a lot of ways, men have kind of ruled the world for, as long as we know. So you kind of look at it from a perspective of, men have this enormous privilege and strength and power that women haven't experienced and haven't benefited from, and have often, experienced a lot of abuse because of that. I think the flip side of that is maybe more particularly in our culture, there's this idea that, as a man, I need to shun and push away anything about me that might appear feminine, which I think is kind of strange because I think, we get into these masculine, feminine categories with things, and I don't know who determined that this was masculine and this was feminine in terms of compassion and kindness and tenderness and things like that. Those are more typically associated with feminine characteristics, but I think those are human qualities. And I think a lot of the messages we get as men kind of push us away from those things that are critical in a situation like this, where you need to be able to tune into these enormous challenges that might face you with parenting in general, but also when you're dealing with any sort of special needs situation, you have a lot of things that aren't solvable. And I think oftentimes men are socialized to fix things, to solve problems, to produce effectively, and those things just don't work. So we find ourselves in this position where, society is kind of pushing us in a direction of more involved fatherhood, which is a great thing. But the acculturation piece completely fails us in terms of the tools and the capacity and the qualities that we need to be involved fathers. So I think anything that allows men to kind of explore human feelings and experiences in an open and honest way without shaming is incredibly helpful, and I think vital to where I think men will need to go in the future if we're going to continue to be involved fathers. You have to be vulnerable. You have to be compassionate. You have to be tender. You have to be you have to have the capacity to tolerate a lot of ambiguity and tolerate a lot of things that don't have a solution, and just sit with them, and be with your kids in those moments and kind of struggle through it with them and not feel like you've got to rescue them. So, I think there's a lot of work to be done in that area in particular.
No, I like that. All those callers you're talking about, I'm just saying, yeah, that sounds great. Any advice on how you develop more of that? I mean, a typical.
I'm a therapist.
Yeah, there you go.
No, I think it's interesting because, I mean, I'll give you this story kind of as context because I say, become a therapist, but even that, I was in a workshop at a conference a couple months ago, and we were given a little vignette to consider about, this particular family that, there were some ethical dilemmas going on. So the people that were directing the workshop were trying to see what will happen when we have a group of men talk about this scenario, when we have a group of women talk about this scenario, when we have mixed, male and female group, a mixed experience group, senior clinicians with beginning clinicians. What they were looking for was, to what extent each of those groups would express compassion for the family's situation and the complexity of this ethical dilemma. So I got put in the all male group. I was a plant, so I was supposed to not really say anything and kind of observe whether or not they expressed compassion. But none of us did. In like 20 minutes, nobody said anything about having any sort of feeling about the situation and feeling torn by it or anything. It was very much like, well, textbook, this is what we got to do. And, kind of. And so I reflected on that. And after, as I was reflecting on it to the group, that whole group of men, and me included, all kind of said, yeah, we thought about that early on, like at the beginning of the conversation. But for whatever reason, just being in a group of guys, we didn't feel like we could say it, which is really discouraging when you think about a bunch of therapists saying that.
Yeah, even the trained therapists are still
still reluctant to. But I think that speaks to the depth of the shaming that occurs when men, and especially boys, express anything related to, compassion or kindness or love or anything like that needs to be nurtured, because that's a human quality. That's not a feminine quality. That's not a masculine quality. It's a human being experience. And so I think what really is probably going to make this change is just pioneering men that have courage to step out and say, this is okay. It's okay for us to talk about this. And I think men that step into leadership roles and help, youth and kids to kind of develop that sense of being a complete human being from early on. I think, the shaming messages and all of that, that's always going to be there. But I think if there's a little bit more weight thrown on the side of advocating for men to be, whole in their sense of some of those qualities and their expression of emotion and their ability to work through their own feelings. I think that's something that I find a lot in my clinical work as I'm working with couples. Generally speaking, men are less able to go to those places of depth, I guess, in their conversation. And there are some differences, I think, in terms of how emotions are processed and expressed and things. I'm not saying that, men need to just be gushing all the time, but I think, when it's a complete kind of blocking off and shutting down to any feelings other than happiness and anger, and you're pretty one-dimensional in that space. And I think men experience a lot more emotional and relationship health when they're able to tap into some of those feelings and wrestle with them and deal with them. And they might deal with them in a different way than females do, but they have the same feelings. I've spent some time, with other cultures and kind of learning how they would handle these things. And some cultures are way more, restrictive than ours in terms of emotional expression, and others are, men are more freely able to talk about these things. So I don't know that it's necessarily just our culture, but I think it's pretty evident in our culture that those are some of the challenges we have.
Okay. One thing you mentioned earlier, yourself being a white male, middle class, kind of in this privileged class, and then through the disability of your daughters, kind of got thrown into this minority population. Could you talk to that and what that was like and what new perspectives that might have given you?
Yeah. I think I don't know that I ever kind of had the mindset that we were going to have the 2.5 kid, upper middle class American dream experience. I don't know that it was ever like a conscious thought, but I think that's just kind of the framework that most of us have, that, our life is going to be this way, and that we have this sense of control maybe over our life. And I think that's a really precarious place to be in, to have this sense of, I can control the way my life goes. Because I think most people you talk to would say that that's not true. There's a lot of things we can influence, and a lot of things we can, we can pursue and develop. But to a large extent, we're kind of in this precarious place in life where a lot of things out of our control will happen to us. So I think that I'm somebody that I think struggles with that maybe more than the average person. I like to kind of have a sense of control over things, and when things shift on me, my typical reaction is to get really frustrated and angry, and then kind of work through those feelings, and then accept it, and kind of have a creative solution to it by the end. But so this was one of those things that really threw me at first, because it wasn't so much that, okay, now this is something different. It was also, I don't even know what things, what life will look like now. I don't really know what to expect. And I think that kind of pushed me in a direction of figuring some of this stuff out. And I think that that's still a struggle today. I think anybody that has a kid with special needs, we're always kind of trying to strike this balance between acceptance and cure. On the one side with the cure, you don't ever want to be in a position where you failed to, provide the opportunity for your kid to have a procedure or a therapy or some sort of resource that would have benefited them, because you were so much on the acceptance side. But you also want to be able just to enjoy life and accept, which doesn't need to occur for us to enjoy each other. And I think that becomes especially critical when you think about the message that you're sending to your kid. If you're constantly in this position of, this thing you have is bad and we need to do everything we can to eliminate it, then you're sending a message to them that there's something fundamentally flawed about who they are. So with the acceptance side, it's, you're kind of trying to lean into this space of enjoying life, and not letting the challenges kind of dominate how things go, and maybe shifting your perspective on some things that maybe this doesn't need to change, or we don't need to do this in order for us to have a fulfilling and happy life. And I think the message that we can inadvertently send, if we're kind of in one camp or the other, is, on the cure side, if we're constantly sending a message to our kids that there's something that needs to be changed, and this condition you have is bad and abnormal and we need to fix it, then I think they can very easily develop an identity that revolves around them feeling flawed as a person. And I think that's really damaging. But also on the acceptance side, if we as parents do nothing to help them with some of the things that might improve their life, then we also kind of send the message that, that they're not worth the attention and that we haven't fought for them as parents to kind of get them to a better place with certain things. So it's a struggle. I think I feel it. I have that framework maybe, kind of before me constantly, and trying to assess, where is it that we're going with this particular phase in our lives, and do we need this? Our daughters just went through, all of them have gone through several surgeries over the past year and a half, and our youngest is going to have surgery this summer in a couple months, and those have been incredible surgeries. They've really been life-changing, particularly for my middle daughter. But but they've all improved, and I'm hopeful that my youngest daughter will improve too in terms of their mobility and their freedom to kind of be more independent and engage with their friends. And so that's been, I mean, for that particular issue, that was more of a cure side, right? We got to do something to address this issue and make this better for you. And then now, there's probably more surgeries we could still do that maybe or maybe wouldn't improve things, but we're kind of shifting back towards this acceptance piece that where we're at right now is really good. And let's enjoy this, and let's let's kind of let you take off a little bit. And that's been really exhilarating too. And I think one more piece to this that is challenging too is, so particularly for our middle daughter, for a long time, anytime we were at a party or anything like that, we were really paying a lot of attention to, is she okay? Is she included in whatever's going on? Does she need help, getting up the stairs? Does she need, and you're just kind of, so you're trying to be there and interact with the other adults, not be rude, but really you want, you're there for your kid too. So, so with this last surgery she had, it's been a really weird shift for us because, she just goes and does what she wants to do. And, so when we're at get-togethers, I remember the first couple we went to, we just didn't know what to do. We're sitting there and we're so used to kind of helping her out, and not interacting with the adults, but then, now it's kind of like, is it okay for us to hang out now? Or, but now, after a little while, it's been a while since she had those surgeries. It's been awesome because it's a win-win. We are able to interact with, the adults that we're friends with, and she's having a blast with her friends. And, but it was a strange transition, and I think there'll be other times we'll probably come up against this again, where we kind of shift back the other way. So I think you have to kind of find this balance between, nothing's ever going to be stable. Maybe everything's always kind of in transition. And if you find a framework that allows you to navigate that, ambiguity in those transitions, that can do a lot, I think, for your ability to enjoy life.
That's cool. Well, Matt, you shared a lot of good stuff here. I'm just sitting here enjoying listening to you talk and taking all this in. Is there anything else you want to hit, I guess, on the story about you and your family and your daughters before we move on?
So this maybe is more kind of my perspective on fatherhood. I think that some things that stand out to me as I look back, kind of going back maybe to that male, kind of the masculinity piece that we were talking about. I think a lot of the medical professionals we had interacted with in the past, I want to be careful because the team we have right now is phenomenal, and I don't experience any of this with any of them. And but early on, I wanted to be really involved in the doctor's appointments and things like that. So oftentimes we'd kind of take turns, and we'd have to drive quite a ways for some of these appointments. So I would go to some of these, and I just started realizing that I was treated quite a bit differently as a dad. Then the interactions were just a lot different than what my wife experienced. They just went a lot smoother with my wife. Doctors were more kind of open, maybe to talking with her about things. And so sadly, at that point, we had to just kind of make the determination that for our kids' sake, it's better for you to go because the doctors, the appointments go better and we get our questions answered and things move in a better direction when you're the one there. For some reason, being a dad there, I just found a lot of, maybe I was spiking people's egos or things like that. I don't know what it was, but I don't think medical professionals in some settings have a lot of training in terms of how to interact with involved dads. And I remember with our oldest one time going on a trip just with her. I was going out for an interview, so I took her with me, and we went out to DC, and I was super excited about it. And everybody we interacted with there, like at the airport, hotel and things like that, just kept asking me, okay, so where's mom? I'm like, mom's not here and I'm totally fine doing this. Like, it's interesting. I feel like sometimes as dads, we kind of get the title without the authority in situations like that, or the flip side, where like sometimes where my wife has gone on trips and I've taken care of the kids while she's gone, you get this kind of pandering type of response from people like, oh my gosh, you're super dad and blah. And it's like, I'm just doing what my wife does every day. And I think those are damaging messages for dads, because it promotes this idea that dads are incompetent. And I think a lot of the male socialization teaches us as males that if I'm not successful somewhere, I stop and I go find somewhere else where I can be successful. So if we continue to get this message that you're incompetent and people need to step in for you, then men are going to flee that space of involved fatherhood, which is so critical to their kids' development. So I think anything that, and I've pushed against that, and I feel like I've, over time it's gotten better. So I think, as maybe as other people consider their responses to dads, communicating incompetence or, praising them for kind of mundane things, I think just perpetuates that message that we're not the ones that should be in that role.
Oh, that's a good point. I never thought of that. Yeah. All right. Now let's take a kind of a little bit of a turn here and hear a little bit more about your practice being a family and marriage therapist. I guess my first thing is, this is maybe a clarification for myself, is trying to understand the industry and psychologists, psychiatrists, counselor, therapy. You have these different terms, and what's some clarification on that first, maybe, and then we'll jump into what you do.
Yeah, no, that's good. I think there's a lot of confusion about that, I think. And so the best answer for that is there are 5 federally recognized mental health professions. So there's psychiatry, which primarily now deals with medication, prescription, and management. And then there's psychology. There's all sorts of branches of psychology. And marriage and family therapy, which is what I do, which is more focused on individual and relationship health and kind of taking into context culture and family systems and things like that. Then there's social work, and then there is psychiatric nursing. So those are the 5 recognized mental health professions by the federal government. And then there's also licensed professional counselors, which are master's level therapists. So I think when most people are looking for a therapist, they kind of just think, what do you, I want a therapist that I fit well with. And that's the most important thing. But if you're looking for kind of specialties, each one of those fields kind of has a specialty. So for marriage and family therapy, it's relationships and how we function individually within those spaces. And that's primarily the context for treatment, although we do individual therapy as well.
Okay, good. That helps. I think it helps people out there. So let's hear a little bit on your experience in your profession, and maybe some insights on relationships, and I guess maybe start off first some common things that you see where people struggle with in marriage relationships, if there are common ones.
Mm-hmm. Yeah, I think when I think about probably the most common thread, that no matter what the issue that is bringing people into the room is, what comes to mind is just basically, how do I feel when I'm with you? If more often than not, I feel tense, or I feel angry, or I feel resentful or distrustful, then logically I'm not going to want to stay here. But if I feel like when I'm in your presence, I can count on you, and if I have a need, you respond to it, and we're connected to each other in some way, then I'm going to want to lean on you, and I'm going to want to be here. So I think that's kind of at the foundation of really any work with couples is, what's going on at that level. So I see a lot of that in my practice, particularly because I do have the specialty in families of children with special needs or chronic illnesses. I do a lot of work with infidelity as well. And so obviously represents one of the biggest breaches in trust and one of the most difficult things that couples can experience. So I see I think that common thread of, can I lean on you and can I count on you? You appreciate me for who I am. I think that's present in any situation.
Okay. In that context, then what would be ways to improve that you found seem most helpful?
Yeah. So I think a lot of times we kind of start out relationships, obviously, generally speaking, I guess, in a good place. Otherwise, you probably wouldn't still be in the relationship if things weren't positive early on. But I think as time goes on and you confront different challenges and things, you can start to kind of pull away from each other. And so I think as I'm working with couples, oftentimes they're at that place of having developed patterns, sometimes over a short period of time, sometimes over, a really significant amount of time, where they've learned that our interaction, our dance is that when things get difficult, I do this and you do that, and we're at the end of the day, we're on completely separate pages and having really negative feelings towards each other. So what I think one of the unique things about working with couples and families is that you can deal with the problem right there in the room. With individual therapy, I'm not saying it can't be helpful, but one of the things I struggle with is it's very difficult sometimes to bring the problem into the room other than in the form of a conversation or a memory or some sort of maybe a role play or something like that, but it's pretty far removed. But when you bring a couple in, the issues they're dealing with are right there. So I think it provides a really unique opportunity for you to help both of those people kind of tune into what happens for me in this situation. What are the things that are going on inside of me that I haven't been able to really explore or communicate, and helping them kind of go to that place of gaining some awareness and tuning into and experiencing those feelings in the moment, and then facilitating a conversation and a bonding moment between the two of them where they can have an experience that goes against what their pattern typically is. And I think when they can experience each other in a safe way and experience some of those feelings of, okay, right now, even though, for the last 15 years, it's gone this way, right now, I feel this way, right? And this is kind of new. And I think it's a delicate process for sure. And it's not an easy one to facilitate, but as you do that more and more, and people are able to kind of slowly work their way into that place where they let their guard down and feel safe around each other, that can start to happen outside of the therapy room. And, it's not to say that people don't ever fight or anything like that, but when you think about that experience of, feeling connected to people and feeling bonded, there's some kind of helpful numbers, I think, to think about there. And this was actually a study with mothers and children, incarcerated mothers and their infants. But they found that if the mom could be a secure attachment figure, basically just respond appropriately to the child's need and be accessible to the child, 30% of the time that child could form a secure bond with that parent. So we're hardwired for that connection. So I think we're also pretty resilient. So as you're facilitating those moments in therapy, even though it might only represent, a half-hour conversation, contrasted with 15 years of fighting, I think that can go a long way to shaping that couple's dynamic and their relationship. So it's exciting. Those are the most meaningful moments in therapy for me, is when I feel like I shouldn't even be there, if that makes sense.
Yeah, no, it does.
This moment where they're connecting with each other and they're raw and they're open and they're leaning fully on each other and feeling supported. And I'm kind of in this peripheral role, and observing it. And those are I think the magic moments in couples therapy. And it happens in family therapy too, when you facilitate that between, a parent and child and things like that. So
that's cool. I guess in that experience, what what are some of the big takeaways you have, I guess, personally in your life, and how you, from seeing all that and seeing other people's lives?
Yeah, it's definitely made me think a lot more deeply about the things that I do or don't do. I mean, I can pretty accurately say that almost every night as I'm working, every day or night that I work with couples, at some point I think about my own relationship, and I think about areas where I'm falling short, areas where I've hurt my wife, or things that she does that that are helpful to our relationship that I haven't appreciated or haven't shared with her. So, I mean, I don't want anybody to get the impression that I have a perfect relationship, because that's definitely not true. But it's kind of one of the things that, like, growing up, my dad was a remodeling contractor, and our house was always in some state of being remodeled. I kind of feel like that's the way my relationships go. I'm kind of constantly thinking about areas that where I'm failing, or where I could improve, and kind of constantly working at it. So I learn a lot from my couples. I think I've seen couples go through stuff that I don't know that I would survive, and see them come out on the other side with stronger relationships, and couples making really difficult decisions where divorce really is the best option for them, and struggling through situations like that where there's really no good solution to it. You just have to find the best of all the difficult ones, and their courage in navigating those paths. So I think anybody who comes into therapy is incredibly courageous, and I feel really privileged to be able to be part of that with them.
That's cool. Something, kind of a theme here. This is just, as we get older, we kind of see life a little different than we saw when we were younger, and thought it would work out a certain way. But there's this concept of this transition, or, things aren't always the way we turned out. There's, things are going to change, and you kind of have to dance with that throughout your life. And, I guess I heard that through, kind of with your daughters, and seeing that in your profession too, and the other people that are out there. I guess, would you have any advice for someone, and how do you deal with that, where things are not really, turning out the way they wanted it to turn out, or that things are changing, and maybe things in ways that we don't want them to change?
Yeah. I think for me, Eastern philosophy has been really helpful in that regard. So when you think about a lot of the ideas that stem from Eastern philosophy and Buddhism, and different fields of thought there, the idea of acceptance and attachment, not the kind of attachment I was talking about earlier, but attachment to material objects or outcomes or things like that, becomes really important. So for me, I think the first step in any change is always awareness, identifying what exactly is happening for me, and how do I slow that process down enough that I can influence some change. So one thing that I noticed about myself, and this will kind of be maybe a metaphor for what I'm trying to communicate, but I noticed that I can very easily, just because of the way my personality is, I guess, and the way my mind works, I can predict and get attached to an outcome in my interaction with somebody before I even start talking to them, if that makes sense. Like, if I do something nice for somebody without even trying, like, you kind of play out in your mind, like, they're going to be so happy about this, and then they're going to have this, like, really special moment where they express gratitude, and and you get attached to, okay, things are going to go that way, right? And then you go in, and the person's like, oh, cool, thanks. And you're like, what? And you kind of have this, like, big reaction, and it's really unfair for the other person, because they have no idea what you're doing. But you can also find yourself in really difficult places, I think, personally, when you live that way. So as you kind of slow those moments down and think, whoa, like my mind's kind of running away from me, or maybe I'm on the other end of it and I didn't even realize that my mind had gone there, but now here I am in the throes of this moment where I'm feeling really frustrated, and I don't know why. I think if you can kind of take a step back and look at what your expectations were, or are, and really assess their value. We don't tend to question our expectations enough. And I think oftentimes when we do, we find that there's really no logical precedent to some of our expectations. And if we can detach a little bit from that expectation and say, maybe that really isn't necessary. Maybe I don't need things to be that way. And maybe I'll be just fine with this other thing, or maybe this other thing is actually going to make me happier. So I'm kind of really, I guess I've been thinking about and into, but I've gotten a lot more into minimalism. I don't know if you've seen that documentary on Netflix, but
yeah, no, I haven't. But I've been trying to get a minimalist on this podcast actually. But I realize it's difficult because they're probably like, say, "Well, is this podcast really part of my life as a minimalist?" They're probably like, "No, we're not going to do that," because so I've had a hard time getting somebody so far.
Yeah, no, I think it's so true. I think just that idea that the things that we think we need to be happy, and the experiences maybe we think we need, or relationships, oftentimes aren't necessary, and oftentimes we're surprised by when we allow ourselves to kind of let go of those things, which is a tough thing to do. I think it creates a lot of anxiety, and sometimes we're very stubborn about it. But the more you can kind of gently challenge those assumptions and take a hard look at your expectations, I think you create some flexibility in your thinking, and you're able to maybe ride the waves of uncertainty a little better. Because they really, I think everybody knows this, but life is full of uncertainty. And, when we sometimes create this expectation of, being able to control things and predict and all of that. And I think a lot of our recent preventive science does a lot of good, but also that's kind of one of the negative side effects of any sort of preventive type of endeavor is that it can lead you to feel like you have some sort of control over an outcome that maybe you don't have much control over. So I think finding peace is probably a better way to state it. When you let go of those expectations and you really allow yourself to truly assess what are those things that are going to bring me fulfillment and peace in my life. It's only a handful of things usually, and it usually revolves heavily around relationships. The number one reason for people seeking any sort of mental health services is relationships. And they have the biggest capacity. This is kind of a weird comparison to the happiness piece, but a lot of the happiness research has been conducted by economists, because I think that was kind of born out of the idea of, does money really buy happiness? And they kind of wanted to test that. And what they found was, when you compare it to money, getting married is equivalent to quadrupling your salary in terms of the happiness boost that you get, and making a good friend is equivalent to tripling your salary. So relationships are key, and anything that detracts from them is probably going to be some sort of distraction that doesn't really lead to the place you're seeking. And developing those close relationships where you feel supported and connected, and experience that the joy and the frustration, right? I mean, relationships aren't perfect, but I think but they can bring a lot of peace to us if we work at them.
That's good. That's I guess one of the strongest themes I've heard throughout this podcast and other people's is that those people around you, those connections, those friendships is key to not, I think, just happiness like you're talking about, but also just in their success in their life too. If they find, success is often because of the connections and the people around them. Yeah. That's very good. Sure. Well, man, I've just enjoyed this tremendously, and I could keep talking to you about different things. And any last things you'd like to share with us, with the audience, and before we part?
I think this is maybe just like a call to action for me included, and all of us, that I think the more we allow ourselves to be exposed to people that are different, while maintaining that focus on connecting with them as human beings first, I think our lives become incredibly rich. Some of the people that I've met that I wouldn't have sought out had my daughter's not had this condition, have been incredible friends and incredible inspiration, and I've learned a lot from them, and I hope that I've contributed in some way to their lives too. But I think we need so much of that right now. There's so much contempt, I think, in our society and world right now. This idea that if you are different from me in your thought or in any other way, then there's something inherently bad about you as a human being. And I think that's such a destructive path to go down. And I think we really need a lot of pioneers to kind of combat that and challenge the idea that that differences are bad, and that we have the capacity to connect with people that are very different from us, and sometimes those are the most fulfilling relationships we have. So I guess I'd just encourage all of us to seek out those opportunities and grow from them and benefit from the things that come from those types of interactions.
That's beautiful. Well, Matt, thank you for spending time with us here on StoryHinge.
Yeah, thanks for having me. It was great.
Hey, thanks again for tuning in. Time for Jay's takeaways. First, thanks to Dr. Brown for spending time with us here on StoryHinge. A couple things here if you want to make contact with him. His email is dr.brown.mft@gmail.com. That's dr.brown.mft@gmail.com. On Twitter, he can be found at Dr. Brown MFT. That's at dr.brown.mft. And those links will be in the show notes as well as on the website. So if you want to see those. All right, a couple thoughts on my Jay's top takeaways today. I want to keep this brief today. I think a lot of content was already shared, but a couple concepts I found very interesting. The first was this cure versus acceptance. And in a disability, I can see that being there, but I think it also applies to pretty much all of life. We can all find ourselves in this place of improvement versus acceptance, or, change versus accepting where you're at. And I think we kind of have to go back and forth on that and find different sides at different times in our life. And I can also see that if we're too far on one side all the time, that could be a problem. For instance, if you're just all about improvement and change and going, and probably will not enjoy as much as you could. I find myself on the side sometimes where I'm wanting to improve, change things, make things better. And, recently I've been looking at ways to celebrate a little bit more. Celebrate the small wins, small victories, as well as the large ones, but to celebrate a little bit more. And that kind of takes us on the other side, to the acceptance side, to accept how things are, to enjoy the moment. I kind of see that as. But again, if you stay on this side too much, you're kind of accepting things, maybe missing opportunities for change, improvement, for growth. And so that's an interesting thing to think about and to figure out where we're at now. And I think that probably cycles back and forth at different times in our lives. So I found that very interesting and very applicable to probably all of us in all our journeys. And the other thing I want to talk about briefly is questioning expectations. And to question them, I think, is pretty valuable, because I think a lot of us, if we haven't done that, we have just accepted the expectations that were put upon us from maybe childhood, or we just saw something and experienced something, and we then built in an expectation and have kept that with us, and really haven't thought about it and thought about why we expect certain things. And this can be anywhere from career to relationships to outcomes and different activities in life. But I think there's some value in questioning that and to really think about, why do I expect this certain thing here? And is that really a realistic expectation? So those are a few thoughts for this week. Hope you enjoyed this one. I sure did. Be sure to subscribe to the podcast and share it with others. Continues to grow, and really excited about some of the work that's going forth here in StoryHinge. We'll continue to bring you more valuable content, and looking forward to interacting with you in the future. So have a great week, and we'll catch you next week.
Thank you for sharing with us at StoryHinge. We hope this time together has added more goodness to your journey. Until next time, onward and upward, and may your own story continue to grow more beautiful.